Hello, my name is Dr. Dewan as Raja. Today I will discuss about the signs and symptoms of cerebellar disease. The cerebellum maintains muscle tone and coordinates muscle movement. The cerebellum controls and regulates the action of the cerebral cortex. Lesions of one cerebellar hemisphere manifest signs and symptoms on the same side of the body, so it is ipsilateral. Acute cerebellar lesion from large cerebellar injury produce sudden and severe symptoms and signs. In chronic cerebellar lesion, cerebellar tumor, the signs and symptoms are less severe than acute lesions. Other part of the central nervous system attempts to compensate for the loss of the cerebellar function. Signs and symptoms of cerebellar disease. These are the signs symptoms like hypotonia, decrease in muscle tone, postural changes, and gait. Disturbance of voluntary movement called ataxia, incoordination, characterized by intention tremor and decomposition of movement, so movement is not smooth. Dysdiadochokinesia, inability to perform rapid alternating movements, that is supination and pronation of the hands. Disturbance of reflexes, that is pendular knee jerk. So if you put a hammer on the ligamentum patelli, there will be more than normal pendular movement of the leg on the thigh. Nystagmus, oscillation of the eyeball, two types of nystagma. It may be jerky, it may be horizontal. Dysarthria, disturbance of articulation, slurred or scanning speech. This happens due to the cerebellar manifestation of muscular incoordination of the laryngeal muscles, as well as muscles of the tongue and mouth. Rebound or lack of check, inability to adjust to change in muscle tension. Dysmetria, past pointing. A form of dystaxia seen in cerebellar disease. Okay, there is dysmetria, that is past pointing, so you cannot go exactly, we may go past. Okay, dystaxia, difficulty in coordinating voluntary muscle activity. So these are the signs symptoms of cerebellar disease. Cerebellum maintains the posture, muscle tone, and it makes the movement to the particular direction, to the particular force, the right direction, right force, and to the right extent. So in cerebellar lesion, there will be movement disorders, and a person cannot move in right direction, right extent, and right force. This is cerebellar dysfunction sign, like that of intention tremor. Tremor, intention, when he try to touch the nose, there will be tremor. Okay, the tremor will be more as it approaches towards the target. Okay, this is different from resting tremor that is found in Parkinson's disease. Here is Dysdiadochokinesia. The person should do some movement, rapid alternating movement. If he cannot, there is a sign of cerebellar dysfunction. Okay, so motor function would be disturbed in cerebellar problem, because we know that functions of cerebral cortex is regulated and influenced by the cerebellum. So examination of the fine motor function, patients alternately touches one nose and the examiner's index finger, okay, with the index finger of one hand, alternately touches own nose with the index finger of each hand, and then we have another test. This is called heel to shin test. Runs the heel, this is the heel, okay, over the shin, okay, down the shin or the tibia of the other leg. So a person cannot do it smoothly in cerebellar dysfunction. Okay, gait is called cerebellar ataxia, wide-based gait with a staggering quality. Hand is not by the side, going a little up. Okay, quality resembles darkness. Evaluation of the gait will be disturbed, balance will be also disturbed. Okay, so we have another sign I've seen in previous picture, Romberg test. This is a test to assess the balance and posture of a person. Okay, the physician or the attendant should be very close to the patient. Patient can stand. When he close eye, then he fall. So this side, that side, maybe front or back, depending on the site of the cerebellar lesion. Okay, this is called Romberg sign. Okay, it may not be always specific for cerebellum. We may have other problem like that of the proprioceptive function loss. Posterior column loss may also cause Romberg test positive like this, but always physician should be by the side of the patient, otherwise he may fall, may be injured. Okay, evaluation of gait and balance, heel toe walking on a straight line. A person with cerebellar dysfunction cannot walk in a straight line in a heel toe walking direction. Okay, we have two syndromes with cerebellar disease. One is Vermis syndrome. Vermis is a junction between two cerebellar hemispheres. This Vermis syndrome is characterized by incoordination of muscle, movement of the central part of the body, head, neck and trunk, with tendency to fall forward or backward. Okay, here limbs are not affected, frequently caused by medulloblastoma or ependymoma. These are brain tumor, medulloblastoma or ependymoma in children, because they like to involve the vermis. Cerebellar hemisphere syndrome, involvement of one cerebellar hemisphere, that is also caused by another type of brain tumor called astrocytoma. The same site incoordination of the muscular movement of the limb and trunk are disturbed here. Limb is affected here. Common diseases involving the cerebellum: alcohol intoxication, trauma, it may be head injury, tumor like that of the medulloblastoma, ependymoma or the astrocytoma. Usually cerebellum is affected by the tumor of the children. Okay, so children has more the tumor in the cerebellum than that of the adult. The brain tumor is more common in children at the cerebellum. These are infratentorial infection, any infection involving the cerebellum like that of the brain abscess, congenital agenesis, vascular disorder, the blood supply in the cerebellum may be blocked, heavy metal poisoning, may lead to cerebellar dysfunction, demyelinating disease of the central nervous system, that is multiple sclerosis, which is very common in the United States and Europe. And that's all about the signs symptoms of cerebellar disease. If you like my video, please support my channel, please subscribe me, please share the information with your friends. Have a nice, wonderful and blessed day. Bye now.